Hello, everybody. Welcome to our session on influenza vaccination preparedness for outpatient provider practices. We're so happy you could join this afternoon. My name is Mary Ellen Casey, and I'm joined by my colleague Melanie Ronda, and we are your Northeast Mid-Atlantic QIN-QIO. So we're thrilled that you could join us on this hot afternoon, if it's hot in your area. We just want to let folks know, if you haven't had the opportunity to hear about or enroll in our QIN-QIO program, you'll see the link in the chat throughout the presentation today, so you can learn more information and learn more about our programs and how we can help you with your quality initiatives. And this is all federally funded, so we are free services for you. So we hope that you take a peek and that you will join us for future sessions like this. Next slide. So our learning objectives today, by the end of this session, our hope is that participants will be able to review the impact of seasonal flu, identify current influenza vaccine recommendations, talk about improving vaccination workflows in the outpatient setting as a whole, increase your vaccine confidence using effective communication tools, and finally, just preparing for the practice for a successful flu season. Next slide, please. So we know that influenza is a serious illness that we face every year. We're talking about this, but it's not just a respiratory illness. It contributes to cardiac events, strokes, worsening diabetes, COPD, and heart failure. And you can see the statistics here on the left. That estimates from the 24-25 flu season, which are out, was classified as a high severity flu year. So there were over 51 million illnesses. You can see the amount of medical visits and hospitalizations, as well as 45,000 deaths. The other thing I wanted to mention, and I think is really relevant for practices to be aware of, is that studies estimate between 17 million and 44 million workdays are lost each flu season. And the total economic burden of this lost productivity and missed wages exceeds $13 billion. So you really do make an impact with offering the flu vaccine. When it comes to lost school days, children typically miss an average of 3 to 5 days per flu infection, so that results in tens of millions of missed school days. So just something to keep in mind on how impactful the flu vaccine can be. We know our high-risk populations include adults 65 and older and young children. In fact, the last two seasons, looking at data, adults and young children were the primary patients hospitalized. Pregnant women as well, and patients with chronic diseases, as well as immunocompromised individuals, which I know with all the great treatments out there, we see a lot of folks that are living with cancer and HIV and different immunosuppressive diseases that really are at risk for the flu. Next slide. So the reasons annual vaccination is necessary include, we know the influenza virus changes frequently. It pretty much mutates every year. Folks recall last year, it decided to mutate right after the vaccine was composed and produced. So that made for a challenging flu season last year, but flu viruses change at least yearly and sometimes more often. So it's very difficult to capture. We know that immunity decreases over time, so what worked for last year's flu shot unfortunately doesn't help you year to year until that time when they hopefully will create a flu vaccine that lasts for more than a year. That would be great. Also, vaccine formulations are updated annually based on whatever is circulating for the year, just to make that as optimal a match as we can for the season. And finally, even when vaccine effectiveness is moderate, vaccinated patients generally experience less severe disease. So you see less severe illness, there's less hospitalization, even less ICU admissions, and decreased deaths. Next slide, please. So the current influenza vaccine recommendation has not changed. I know there's a lot of talk, it's been both political and scientific on who's giving what for recommendations, but universally, the optimal recommendation is that everyone aged 6 months and older should receive annual influenza vaccination unless contraindicated. And also that the preferred timing is September to October for most patients, You can continue vaccinating while influenza viruses circulate, and we've seen that with influenza B. It circulates well into the spring. But optimally, it's September and October. Now, if you have a patient that's come into your office and it's August and it's an annual visit and you have the vaccine available and you think, I'm not going to see them for a while, then, that's a good time to get them, because August is better than not getting it at all for the season. So they're sort of the outliers, and I know, you don't see all your patients in September and October, but you can kind of play around with it depending on your patient who may only see you once a year versus the patient that would come back to the office for a flu vaccine. Next slide. So, I think we might have, did we skip a slide? I guess not. Okay, sorry about that. So influenza, no, that was on my end, sorry. Influenza vaccine products, as you know, there's a variety of vaccine products available depending on what you obtain for your supply. There's the standard dose that's inactivated, meaning that it's not a live vaccine, and so the standardized dose is the one most commonly used. But there is a high-dose vaccine, adjuvanted vaccine, and also the live attenuated vaccine, which is the nasal spray. So depending on availability, what you order, maybe you're a practice that sends your patients out to have the vaccine if they choose to get one. Just know that there's different choices. As far as older adults, and this is I feel the population that people probably are talking to the most. It is preferred that an adult 65 and older get one of the high-dose vaccines. As I mentioned, high-dose, the recombinant, the adjuvanted are all vaccines that give a little extra to older adults whose immune response is a little bit slower than younger, healthier people. That being said, CDC doesn't say you have to do that. They prefer it, but if the standardized vaccine is the only one you have, better one than none. That's their stance on that. Next slide. And so these are the key recommendations and updates for the 26-27 season. The composition this year is they tweaked the H1N1 A virus, and they tweaked the H3N2 virus. As I mentioned, that virus mutated a little bit after the vaccine last year, so they tweaked it based on last year's history. And then the influenza B, which is the Victoria strain, which hasn't changed, and that has circulated really for decades and is still the same. So again, the adults who are 65 and older, you have the choice of a high dose, and you also have the choice of flu mist for your patients that are between the ages of 2 and 49 and not pregnant. The flu mist is a live virus, so there's only a certain population that can actually take that if that's something that you're offering. Egg allergies have sort of, I don't want to say they've gone by the wayside, but they did make the recommendation to continue that you can safely give a flu vaccine even with an egg allergy, age appropriate and all that. It's no different than any other allergy, so it's fine to give the vaccine with that. And that changed, I think, 2 or 3 years ago. And then finally, I mentioned the nasal spray that's option for healthy adults between 2 and 49 who aren't pregnant. Next slide. So contraindications and precautions, certainly contraindications where someone has a severe allergic reaction to a flu shot should not get one again. The age restrictions depending on your population. And then precautions are really, if you have someone who's moderately or severely ill, obviously they're not going to be receiving a flu vaccine and probably wouldn't want one. But if it's mild illness and they're in the office and it's an opportunity for a vaccine, you might have a conversation with the provider to take the vaccine. Just be a little bit precautious about side effects. If they have a history of Guillain-Barré syndrome, that's a clinical judgment on the part of the provider, so that's definitely a conversation that the provider wants to have with the patient if they should indeed take the flu vaccine. And I think a lot of time in practices are spent clarifying common misconceptions. You folks deal with, patients are coming in, they trust you, and they're bringing, misinformation and the things that they've heard out there to you. So it takes some time as part of this vaccine administration to really clarify some of the misconceptions that they may have. Next slide. So vaccine storage and handling, best practices are to monitor your refrigerator temp twice a day, maintain that cold chain. You should rotate your stock and check expiration dates to make sure that everything is within the window to be able to administer it. And then have contingency plans for power outages. And this has been a real issue, especially with the weather, the climate change issues we've had. If you're a practice that doesn't have, perhaps there's a pharmacy that you have a relationship with that would store your vaccines, say, over a weekend if they're open, so that you don't have to worry about losing power to your refrigerator, or a hospital that's close by that you have a relationship with, that you have some kind of a plan that if the vaccine needs to be moved, there's a place that it's going to go to and there's a process. There are some great resources if you're new to this. I want to mention immunize.org, which, if you haven't checked out that website, is a really great resource. And as part of the slides today, you'll have that link with the slide deck. But they have a plethora of immunization resources, not just on vaccine storage, but they do have a section on their website that does focus on that. And the CDC also has an updated toolkit for 2026. It includes information on the vaccine cold chain, staffing, training, vaccine storage units, temp monitoring, vaccine inventory management, you name it. It's a nice toolkit, and I was glad to see that they had updated it. Next slide. So it's good, it's kind of like back to school checklist back for influenza season prep. I can't believe we're even talking about it in the heat of summer, but here we are. You might have a checklist, you do something on paper, you have something in your EHR, however you track things. But something to think in mind is order your vaccines early if you haven't done so already. Sometimes the supply issues are a real challenge, especially when everybody's ready to go and the vaccine hasn't arrived. Revise your standing orders, update your protocols, train staff. You might have staff turnover where you need to train your staff on what your vaccine administration process is. Verify all your equipment. Prepare patient education materials if you don't already have them, and I go back to immunize.org because they have a lot of great patient education resources, as well as they make sure the updated vaccine information sheet is on their website, so you can just print it and you're good to go. If you want to update your EHR alerts, now it's always a good time just to have all your ducks in order, and then finally scheduling your vaccine clinics. Next slide, please. So standing orders, I just want to talk about a little bit. They really increase vaccination rates. They allow nurses, MAs, pharmacists, if you have them in your practice, to really just, the workflow process goes so much smoother because they're having the conversation, the patient is willing, they're ready to go. And when you don't have standing orders, you have to stop and get the provider order. It's just sort of, sometimes it tanks. So to have that process in place, the benefits are really, they're great. The workflow is better, the vaccination rates are increased, and there's much less missed opportunity with standing orders. Next slide. And so the big thing, if you can take anything away from this, that every opportunity matters. Every visit is a vaccine opportunity. Again, we mentioned timing, and sometimes it's not always optimal, but think about your annual wellness visits, your diabetes follow-up, if someone's in for a blood pressure check, or it's a Medicare wellness, as well as someone who's sick, who may not be too sick that perhaps they could get a flu vaccine at the time if they're not going to come back again. But it's certainly important to ask every patient, you're due for your flu shot, and ask it in a presumptive way. You can ask them, but just kind of state it as a fact that, oh, you're due for your flu shot today, and we have the supply. Would you like me to give it to you today? And see what happens. Because a lot of times they will take it when you presented it in that manner. Next slide. I'm going to turn it over now to my colleague Melanie to talk about some other virus season readiness.
Thank you. I can't believe we're talking about respiratory virus season already. Are we just at the beginning of summer? I was thinking, right? We like to think about wave. We use the slogan wave. What about vaccine at every time or every encounter? And that's really what we're looking for you to be considering. Looking at your patient that's that's in front of you and considering what vaccines are appropriate for this person at this time. And, you know, RSV vaccine it's interesting that for many years, we did not really think too much about adults and having RSV. But in fact, RSV can be very dangerous. And for certain adults, each year, an estimated over 180,000 adults ages 55 and older are hospitalized for RSV. And we certainly see that there are a lot of outbreaks of RSV, specifically in long-term care, which then ends up residents being hospitalized. And it's really important that we are screening and discussing whether or not the RSV vaccine is appropriate to the patients you are seeing. So adults over the age of 75, they should routinely get the RSV vaccination. Adults 60 to 74 years old should be vaccinated if they have increased risk. So are they immunocompromised, chronic heart or lung disease, diabetes, CKD, just frailty, and obviously those in long-term care. If they're in long-term care, we should be vaccinating our residents with RSV vaccine. And pregnant persons, RSV vaccine at 32 to 36 weeks gestation, and infants, that infant's protection via maternal vaccination or infant monoclonal antibody per current recommendation. So there's also a nice resource on CDC that you could put in your offices so that people can be asking you questions. So you can post it on your bulletin boards, post it as people are entering. And that's the first way to start talking about RSV. Maybe you hand it out to your patients as they're entering your offices. So considering vaccine timing, we ideally administer before RSV season, which is late summer to early fall, and that's why we're talking about it now. But vaccination can be given later if not previously received. So you really can offer it anytime. I'm curious for those that are on and able to put in chat, are you regularly offering RSV vaccine to your patients? That would be nice to know. And if there's any resources that you could use that we can help you with. Use any currently vaccine selection, use any currently recommended RSV vaccine according to the approved indication availability. RSV vaccine so far is generally a 1 dose. Routine annual revaccination is not currently recommended. So that's good. It's a one-time thing, thankfully. And also it's really important to know that you can give it with influenza and COVID vaccine. So you can co-administer RSV vaccine. And so RSV vaccine implementation considerations for outpatient, identify your eligible patients. How are you doing that? Something you need to think about. Who is screening and how is that screening happening? And who is discussing it with your patients? And then vaccinate before RSV season. So now's the time. Incorporate RSV vaccination into routine preventative care. So if you're a facility or an outpatient practice that's not currently offering it, is now the time to start offering it. And educate that RSV vaccine is not a live vaccine and does not treat existing RSV infection. So another really important vaccination for those over the age of 65 and other depending on your comorbidities, is pneumococcal vaccination. And we are really trying to close the gaps with the pneumococcal vaccination. And anybody who's been in healthcare for a while, you know there's been a lot of shifts with what vaccines available. But pneumococcal disease can cause pneumonia, bacteremia, meningitis. A lot of times people think of pneumococcal vaccine only going to prevent pneumonia, but it's actually pneumococcal disease. So older adults with chronic conditions are at increased risk. There are links incorporated into this presentation that will be really helpful to you to determine which vaccine for what patient, because again, there's been some changes. And I'll get to this. So any of you that are providers and determining which vaccine, hopefully you found this the Pneumorex Vax Advisor. It's an app, you download it. It can be on your phone, it can be on the desktop in your offices. And this helps determine which vaccine your patient needs. Very useful. Lots of providers use it. It's very helpful to determine what you need to do. For adults 50 years or older, administer PCV 15, PCV 20, or PCV 21. If PCV 15 was used, administer a dose of PPSV 23 1 year later. So most providers have moved to that 20 or 21 to reduce the need of having an additional dose. But again, here are some tools to make some decisions with, and then Pneumorex Vax Advisor. There is a link and you can download that right on your phone. So vaccine workflows. I'm curious to know if you could put into chat who's starting the conversation. Is it starting at the front desk with the health history? Are you looking at all adult immunizations at that point? Are your medical assistants, no matter what your patient's coming in for, asking about vaccines? And maybe that's an opportunity for your practice to advance in, is to just, let's be asking all the time. Are you recommending, if you're the provider, are you recommending which vaccines need to be provided? And then who's administering the vaccine and who is documenting it? And then if you're in a state with a registry, who puts that in? And so there's a lot of steps to administering vaccines. Certainly if you have a state registry, it's really important to become registered in that and put the information in, so it makes it easier the next time when you have a new patient, that you're also able to find the information for your new patient in that registry. Each state's different about the registry. I wish it was a federal registry, but for right now, we still have state registries. So addressing vaccine hesitancy. Boy, have we had a lot of challenges with vaccine hesitancy over the last few years, and we're seeing some real shifts in acceptance of vaccines. It's really important to address safety, the effectiveness, the side effects, be prepared to talk about misinformation and misconceptions, because we certainly are hearing a lot of that. I never get the flu. I got sick after my flu shot. It's the flu shot that caused me to get the flu. And making sure we have the information to be able to combat these myths. We recommend you use motivational interviewing, really listening to the person, try to address their concerns, use evidence-based education, be very transparent with your communication, and that one-to-one counseling is really important. There are a lot of people that actually, that are afraid of needles. So how are you addressing the fact that your patients actually, no, I'm not getting a needle today. I'm not ready for that. Is there a way to kind of prepare that patient that today's the day to get the vaccine? It's going to be quick. We're not going to, or is flu mist available so you don't have to worry about injecting? But there is definitely a lot of fear of needles that we have to manage with our patients. So effective communication, and we don't have a lot of time to talk about it. Motivational interviewing is a real technique. There's lots of ways to do that, but there's the way to say you're due for your flu vaccine today, rather than would you like your flu shots? Because a patient might say, no, thank you. And then if a patient says, I'm not sure, this is the time to say, what concerns you most? Let's talk about it. Let's listen. We're going to reflect. We're going to provide brief interview information, recommendation, and support. And I really like this share model that is available from the CDC. Share and highlight, address, remind, and explain. And this is a nice way to train your staff when they're talking about vaccines. Share the reasons. So highlight the positive experiences, explain why the specific vaccine is right for the patient based on their age, health status, lifestyle, occupation, and other personal risks. Address patients' questions. No question is a dumb question, right? We need to take the time to address their questions and answer them. Their concerns about side effects, safety, effectiveness, in clear, plain, and easy to understand language. And I also recommend you have information in the language that your patients understand. Then remind patients, remind them that the vaccine helps protect not only themselves, but also their loved ones. Maybe they have children at home or grandchildren or grandparents, and this is why it's really important to get that herd immunity to provide safety to their loved ones. And explain the potential costs. So discuss the potential consequences of getting sick, including missed work, family obligations, or financial or severe burden. And the share model, you can find this on CDC. It's a nice way to teach your staff on how to have the conversation. So I do recommend that you go onto that website and take a look at it. Now, the important thing, documentation and reporting. So you do need to document when you give a vaccine, the manufacturers the manufacturer of the vaccine, the lot number, the expiration date, the site, the VIS provided. So the vaccine information statement, you have to document the date of the that you gave it, but also the publication date. Both of those dates need to be documented, and that's federal regulation. So if that's not something you're currently doing, you want to take a look at that practice. We need to be providing the most up-to-date vaccine information statement, and we document that date and the date that it was created. And then, of course, administer the vaccine. Quality improvements. We can monitor our vaccine rates. We can review missed opportunities. That might be a place you want to consider. You may want to create some dashboards that shows I've seen 15 patients today. Not really, you probably have seen 100 patients today, and 95% of them we reviewed and screened for need for vaccinations. And then just make sure you're documenting and then also have a process for vaccine inventory. You don't want to be, oh, I ran out, so I can't provide this. Can you come back next week? That could be a missed opportunity to protect someone. And then high-risk patient coverage. So knowing your patients and knowing who really needs it. An office action plan, we can stop. You may be considering right now, okay, we're talking about immunizations. We need to make sure we have a plan, staff education, standing order reviews, vaccine ordered. Is it done? Do you have it? Where are you going to store it? Have you checked your refrigerator yet for the season if you only give influenza? How are you putting alerts on the patient's medical records? And then how are you sending out reminders to your patients? And then also, who on your team is vaccine champions? Action planning, what will your practice do before this influenza season? I'd love to know if you're considering something after this conversation. You can put that in chat. What can you do that can enhance your vaccination efforts? And I do like the one offer vaccination at every eligible visit. So waive, what about vaccine at every encounter or every time? Some key takeaways for today: influenza remains a significant public health concern. Annual vaccination is the best prevention strategy. Strong provider recommendations increase vaccine uptake. So it does rely on you to be out there communicating, educating, talking about it, and myth busting. Efficient office workflows reduce missed opportunities. Every patient encounter is an opportunity to vaccinate. We have a lot of resources that we'll send out to those of you that attended. And we are so happy that you joined us today. Love to know if you have any other questions that we can follow up on. And I'll stop, and you can enroll now. You can scan this QR code if you're not enrolled in the 13th Statement of Work Quality Improvement Project. Is there any questions in chat?
No, not at this time.
All right. Well, thank you so much for joining us.
We hope this was helpful for you.